My story starts in 2010 when I took a year off work and went to Bolivia to volunteer at an orphanage and travel. So as part of my travels, I came across a town called Potosi, which lies beside the ancient Cerro Rico mine. And you can see it there. This mine's been operating nearly continuously for 500 years. But by 2010, it was mined solely by hundreds of small cooperatives, with conditions so bad that it had become a tourist attraction. So 2 years later, I decided to return to Potosi to conduct a volunteer occupational hygiene assessment, working with a local NGO and with the support of my then employer and the helpful advice from lots of Aussie hygienists. So what did I find? Well, as I'd expected, I found exceedances of total dust, silica and carbon monoxide, as well as dangerously low oxygen levels. So, several months later, I documented my findings and recommendations, translated them into Spanish and sent them to the NGO. And I haven't heard from the NGO since, and I haven't been back to Potosi since. So fast forward a few years to this year, and I had the opportunity to return to the topic of small-scale mining as part of a systematic review assignment for my Masters of Public Health. So the aim was to review interventions that have been attempted to reduce occupational respiratory disease in small-scale miners. But I also wanted to find out, exactly how much was known about the problem itself. So that begs the question, what is small-scale mining? Well, it's mining conducted by individuals or cooperatives without legal mining titles and using minimal machinery or technology. And so they don't have very good productivity. But here's the thing about small-scale mining. It's actually massive, producing up to 20% of the world's minerals and metal production and employing 30 million people, including 1 million children. So what did I find about exposures? Well, on the one hand, there's been hundreds of studies into mercury exposure in small-scale gold mining, showing significant exposure to mercury. But as for other exposures, the literature is nearly silent. Although this very small number of studies that have been done, including my own, suggest high exposures to dust and to toxic gases. And when it comes to disease burden, it's a similar story, with the burden from chronic mercury intoxication relatively well characterised. But actually zero studies on the rates of other respiratory diseases. And when it comes to interventions, even for small-scale gold mining and mercury, I could only find 9 intervention studies, and only 2 of these were actually successful in reducing disease. And I could find no studies looking at other hazards or sectors. 30 million workers, 1 million children, significant exposures, and no control. So what's the way forward? Well, I think we need to look at our own experience, because we've reduced disease rates in mining in our country and other developed countries. Let's try to learn from that. So here's my humble oilies take on how it was done. So first of all, a common understanding was come to between all stakeholders in the sector that there were risks and there were ways to control the risks. Because if people don't know there's a problem, how can they want to control it? Secondly, small-scale miners need access to affordable and effective control technologies and PPE. Because if they want to control it but they don't have access, how can they control it? And thirdly, there needs to be effective regulation and a strong inspectorate in these countries to define good practice and enforce health and safety in small-scale mining. So back to my story. Did I make a difference? Unfortunately, no, I don't think so. The mining continues, the exposures are probably still the same, and it's still a highly rated tourist attraction. So that leads me to finish this talk by again asking myself, and you all hear this question: what can we as hygienists do to help these small-scale miners have the same chance of a long and healthy life as miners in Australia and other developed countries? Thanks.